Dinner. All right, so most of you know and love Megan. She's our nurse practitioner here at Chevy Chase Facial Plastic Surgery. She's been expertly trained by Dr. Jennifer Parker Porter, the owner of our practice, in advanced aesthetic techniques, specializing in treating all skin types with precision and care. Over the past year, Megan has developed a comprehensive wellness program that focuses on weight management and overall health, empowering patients to achieve their body goals. So she's really diving deep into a patient's medical history so that they can reach their aesthetic goals, and she's taking a holistic approach on that. She's passionate about patient education and empowerment. That's the reason we're here today. She's dedicated to helping individuals understand and embrace the benefits of cutting edge aesthetic treatments. And then she's extensive experience in non-surgical body contouring. As I mentioned, Chevy Chase Facial Plastic Surgery is a top 10 provider of Morpheus8. And Megan has really spearheaded that. So you are in great hands with Meghan Fay. And with that, I'm going to go ahead and turn it over to her. She's going to do a deep dive on Morpheus8 Body for us.
Thank you so much, Kat, and thank you so much, everyone, for tuning in to our Morpheus Body webinar. I am so excited to share with you everything I know and love about one of my favorite treatments that we offer. If you're already a patient of mine, then you've likely already had a treatment or three, but for those of you who haven't, I'm going to start with the basics of what Morpheus is, how it works, and then we'll get into how the new deep burst tips offer even more effective ways to treat anywhere on the body. Then I'll describe what to expect before, during, and after the treatment, when to expect results. And then we'll turn it back to Kat, who will go over your exclusive perk for attending today before I can answer all of your questions at the end. So let's get into it. Morpheus is the gold standard for non-surgical anti-aging and skin tightening treatments. So as we age, our skin loses elasticity and our overall skin texture deteriorates, which leads to the visible lines and wrinkles. And we tend to gain fat where we don't want it and lose the fat where we do want it. We experience bone loss, collagen changes, maybe pregnancy, which all lead to changes in our bodies that are uncontrollable. Before the Morpheus, most patients were offered surgery or non-surgical treatments that didn't produce impactful results. But once the Morpheus came out, it was loved by celebrities and aesthetic providers, and the awards this company has won every year since it was released is just proof that it has changed the status quo. It provides real game-changing results for our patients. And in short, I recommend this treatment to my patients because I really believe it works and I feel passionately about its proven results. So the Morpheus technology, it will initiate a wound cascading healing process, and it's going to help remodel the skin. It's going to stimulate the new cells to migrate to the damaged area and regenerate the collagen. This process will start to take about a month and continue for a total of 6 months after. So that leads us to a more natural development of results. Over those 6 months, the skin will tighten, the cellulite and the stretch marks will soften, and if intended, the fat can be melted or ablated in certain areas. So what is Morpheus? Morpheus is a combination of both microneedling and radiofrequency. So microneedling creates what I like to call a controlled injury, further improve deeper laxity and even ablate fat if administered at the right setting. This energy creates almost an extra millimeter of treated area due to its heat profile. The graphic shown here illustrates the different needle tips included for both the face and body treatments. The depth shown for each tip the extra millimeters that are reached with a thermal energy beyond where the millimeter, meaning it has the ability to treat multiple layers of anatomy depending on the settings used. The prime tip is similar to the Morpheus tip, except it is half the size, so it can fit into more contoured areas such as around the eyes. Now, this newer deep body tip goes up to 7 millimeters deep, or 8 millimeters, including that additional heat profile. It has almost twice as many needles as the Morpheus tip, and it allows us to cover more surface area with each pulse. Now, the new burst technology, which is included with the deeper body tip, it is unique because it allows us to target multiple depths in one single pulse. So for example, the radio frequency energy can be delivered at 7 millimeter depth, 5 millimeter depth, and 2 millimeter depth, all in one pulse, which allows us to both ablate that deep fat and resurface the skin texture all in one pass. Because of this, the treatment can be done faster than ever before, and the settings can also be adjusted to provide an upward scaling pattern so that that deeper tissue can be treated at a higher energy setting than the superficial tissue, which is ideal for skin of color, delicate skin, or more sensitive areas. I only mention these settings in an effort to emphasize that a Morpheus treatment is completely customizable to achieve each individual's unique goals. Now, I know that this may be more of a concern voiced by my patients interested in treating their face than those interested in treating the body, but I have to address the number one question I get asked about the Morpheus. Will it cause volume loss? In short, yes, the Morpheus can cause fat loss, but only when intended to. The best part about the Morpheus is how customizable its settings are. A Morpheus treatment does have the ability to melt fat, but it can also simply smooth and tighten the skin superficially, or it can do both at the same time, as we saw with the burst technology, all by adjusting the many settings available on the device. So the depth of the needle determines the plane of anatomy that will be targeted. The energy of the radio frequency determines the strength of the thermal energy. And the pulse pattern has multiple different customization to deliver the heat in its intended and most effective way, depending on your skin type and what we're trying to achieve. That is why it is so important to carefully choose your Morpheus provider, ensure they are well-trained and experienced, review your aesthetic goals with them so that you can tailor the treatment to your specific anatomy and just trust the process. With that, I'd like to ensure that the Morpheus is safe for all skin types and complexions. It does protect the dermal pigment when delivered in the correct way and when the settings are unique for each individual. The body treatments will be ideal for those with areas of stubborn fat, but keep collagen coming in, keep everything young and tight, or to help maintain your surgical results. So this is great after your surgery, just to maintain those results that you had after your procedure. This is also ideal for our postpartum mothers who are interested it's not going to provide immediate surgical results, but it will induce natural collagen production to maintain the health of your skin and the deeper soft tissue. So where can the Morpheus treat? It can treat virtually anywhere, but some of the most popular treatment areas include the abdomen for tightening the skin after weight loss, helping with stretch marks, C-section scars, and those stubborn fat pockets. Another popular area is the back. It can help smooth that bra line fat, tighten any loose skin. Also the flanks, it can help smooth love handles, help to contour and tighten for a smoother silhouette. On the thighs, we tend to get cellulite, more skin laxity, and the textural irregularities. Also, the knees are really popular. That's where we tend to get the crepey skin and the sagging above our knees. This will help with all of those wrinkles and fine lines. Also, the buttocks, we can reduce the cellulite, the stretch marks. We can give you a more firm and lifted appearance. There's also what's called the banana roll, which is right underneath the cheeks between your buttocks and your thighs. Also, for those arms, we're always concerned about our bat wings. This will help with firming for a more toned appearance, help with any skin laxity there. We also tend to get the crepey skin on our arms, so it'll help with that. And of course, the hands are often forgotten, but that's a major sign of aging. So it's important to treat those, make sure that they're firm and tight on the back of our hands, reducing the appearance of wrinkles and fine lines. So what can you expect before your Morpheus appointment? We will start with a consultation, and that will include a thorough review of your medical history and goals. We'll also do a scan on our in-body machine, which gives us a full metabolic profile from head to toe, including your body fat and muscle percentages and proportions, and it gives a recommended daily caloric intake. So these results may spark a more comprehensive evaluation for eligibility into our weight loss program if interested. And we highly recommend that anyone undergoing a weight loss regimen incorporate the Morpheus into their treatment plan to target skin tightening while they're losing the fat. And this initial consultation is important as your unique background and goals will determine your settings for each treatment. Then on the day of your Morpheus treatment, plan to be in our office for about 2 hours. So allow time for the topical numbing, bring something entertaining to occupy your time because you'll be sitting in there for about an hour numbing. And the anesthetic can only be applied to so much surface area at a time. So the treatment area will be selected with this in mind. And depending on the area being treated, I may prescribe a preventative antiviral medication to be started the day before the treatment. I also prefer my patients to have eaten a meal prior to arrival. I like for you to wear loose, clean clothing so that nothing will be tight on your skin or cause irritation afterwards. And please avoid blood thinners such as Advil, aspirin, ibuprofen. Those can just prolong healing time. And come with clean skin. Do not apply any products such as makeup or lotion to the skin before the procedure. In addition to the topical numbing, we also provide Pronox, which is nitrous oxygen. It helps reduce any anxiety related to pain. And you'll have access to this gas throughout the duration of treatment, and its effects will wear off only within minutes of stopping, so you can still drive yourself home afterwards. And as discussed earlier, Morpheus is a combination of microneedles, which puncture the skin to various depths, and the radiofrequency energy, which creates heat beneath the surface. And our deep burst technology allows us to treat multiple depths and cover more surface area in one pulse, which reduces the need for multiple passes, resulting in a faster and highly efficient procedure. Immediately after the treatment, you should expect to look and feel like you have a moderate sunburn. You may also have temporary swelling, bruising, crusting, peeling, needle grid marks, or tenderness in the treated areas, and this will continue for a few days or longer, with some body treatment recoveries lasting for even a few weeks. No bandages or wraps will be necessary, but those first 48 hours are essential for keeping the skin clean and moisturized with a healing ointment, such as Aquaphor. It's a little less greasy than Vaseline. I will want you to treat your skin gently, avoid scrubbing it or any trauma to the area. Don't put hot water directly on the treated skin, and definitely avoid direct sunlight while your skin is healing. This treatment will be creating open channels in your skin, which will take a few days to close, which is why even sunscreen should be avoided for the first few days following the treatment. I want you to think of your treated skin as an open wound during this time. And if PRP was applied, I don't want you to wash it off for about 8 to 24 hours. PRP is platelet-rich plasma, which is an optional add-on for any microneedling treatment. Basically, what we do is we draw your blood and we spin it in a centrifuge so it separates your red blood cells from your plasma, and then we draw out the platelet-rich portion of the plasma, which has all of your stem cells and growth factors. And at the end of the treatment, I topically apply the PRP to the treated area so that it is absorbed into all of those microchannels that we created. And this will both enhance your results and accelerate your healing time. And it will make your skin feel tight and dry after I apply it, but I would like for you to sleep with it on your skin that night. And then when do you see results? You'll begin to see them within the first month, but allow 3 to 6 months for the full effects to take place. As I had mentioned in an earlier slide, the collagen begins to build within 30 days, peaks at about 3 months, and continues for a total of 6 months. So the results will be gradual, not immediate. And depending on how long your healing time takes, you may benefit from a series of 3 treatments spaced about a month or 2 apart, followed by 1 maintenance treatment per year. So although the results of this treatment are long-term, they will not stop us from having our birthdays. So annual maintenance treatments will always be necessary to keep up with our natural aging process. Thank you all for attending and listening to